Here's what spine surgeons will never tell you. The spine problem they show you on a scan may not always be the reason your back actually hurts. You're sitting in a surgeon's office and they've got your MRI up on the screen. There is a bulge or a herniation or degenerative disc disease showing up. The surgeon looks at you and says, "You need surgery." But I've seen thousands of patients walk into my clinic after spine surgery feeling worse than they did before they went under. Some of them have had surgery on a disc that wasn't the real cause of their pain. Others had surgery way too early before giving anything else a real chance to work. Now they're dealing with scar tissue, problems from the fusion, brand new pain they never had before, or sometimes still dealing with the same pain they had before surgery. For over 20 years, I've pioneered what actually works and seen what doesn't. I've seen the difference between people who rushed straight into surgery and people who tried a completely different path first and actually had better results. I'm Dr. Savir Rao, board certified in anesthesiology and pain medicine. And in the next few minutes, I'm going to explain why surgery gets done way more than it should, what you should really try first, and exactly how to figure out when surgery might actually be the right choice for you. You're going to see a whole different path that most doctors simply don't talk about. The surgical myth. The idea is that something is broken in your spine. The image proves it, right? You can see the disc herniation right there, the degeneration right there. So if you take it out, fix it, your pain should go away. This belief has stuck around because surgeons are really good at their jobs. They can spot the problems on imaging. They can remove it. So it sounds logical that picture shows damage, remove the damage, problem solved. But this is just not how it works. 3 out of 10 people who have absolutely no back pain at all show disc herniations on their MRIs. That's 30%. If that disc bulge was really causing the pain, then 30% of people would be in serious pain all the time, but they're not. The image shows what your spine looks like. It doesn't show where your pain is actually coming from. Most surgeons operate based on what they see in the imaging, not on what's actually causing your pain. This doesn't mean imaging is pointless, and it doesn't mean that your pain isn't real. What it means is that a bulge on the screen and your pain can be two completely different things. The bulge might be there, but it's probably not the real or only culprit of where your pain is coming from. Before you even consider surgery, you have to figure out where your pain is actually coming from. Because as long as you don't know the actual source, cutting into your spine and taking things out is basically just guessing. I've worked with patients who have had really big disc bulges, and they've gotten much better with a different approach. I've also worked with patients who barely had anything showing on their MRI, and they were in tremendous pain. We have to dig deeper to find what's really going on. So if the bulge isn't what's causing the pain, what is? Let me show you. Let's say your doctor ordered an MRI. An MRI is basically the gold standard for this kind of thing. The doctors look at it, they told you what they saw, and that becomes your diagnosis. That's just how modern medicine works. You describe a problem, you get a test, the test shows something, and that test result becomes your diagnosis. The only problem with that is an MRI shows structure. It shows what your spine looks like, but it doesn't show function. It doesn't show whether something is actually causing pain. You can have a disc that looks pretty bad, but works fine. You can have a nerve that's barely touching anything, but has tremendous inflammation around it. Your surgeon is solving for what they see in the imaging, not solving for your pain. There are two completely different problems. This isn't actually your doctor's fault. It's just a limitation of the tool itself. An MRI is designed to show structure. That's what it does. And it does it well. But pain, especially pain that's been going on for a long time, usually isn't just about structure. A real diagnosis needs much more than just an image. In my practice, I use advanced lab testing that standard doctors almost never order. I find inflammatory markers that explain pain even when the MRI looks fine. I find nerve sensitivity issues that a regular test would completely miss. When you have that kind of information, surgery often becomes totally unnecessary. When you get a real diagnostic workup done, you can actually understand what's causing your pain. Once you know what's really causing the pain, what comes next? That's where the gate comes in. If someone's told you that you need spine surgery, this part matters. Hit that subscribe button. I'm going to show you exactly how to handle this before you make a choice you can't take back. The gate. Think about the last time you had a health problem that was bothering you. You probably tried one thing. It didn't work. You tried something else. That didn't work either. So you went up a level, you saw a specialist, and the specialist said, you need surgery. And you thought, well, I've tried everything, but you really hadn't. You've tried some things, not everything. I see this pattern happening over and over again. Someone has back pain. They do physical therapy for a couple of weeks. It doesn't fix it overnight. They stop doing it. They try some over-the-counter medication, the pain is still there. They get an MRI, see a disc bulge, and the surgeon says you need to operate. They get the surgery done. 6 months later, they feel worse than they did when they started. Questions you need to ask. Have you gotten targeted epidural injections with proper imaging to calm down the inflammation right where the nerve is irritated? Have you tried medial branch blocks to see if the facet joints are the problems? Have you had radiofrequency ablation to reduce pain signals coming from the joint? Have you used regenerative medicine with growth factors or exosomes to help tissues heal? If you haven't done these things, you haven't reached that gate yet. You're not ready for surgery. I have patients who felt better after just one intervention. I have patients who needed several different approaches, but every single one of them tried all the minimally invasive options first, and the results are dramatically better when you do it that way. What does it actually look like to pass through the gate correctly? That's what point number 4 is about. Point number 4 is the regenerate approach. The standard way most people approach this is pretty straightforward. Feel pain, find damage on the imaging, remove the damage, and hope the pain goes away. My approach is different. It's called regenerate. You figure out what's really going on, you get specific about where the pain is actually coming from, then you use the right tool for that specific problem. I see this constantly in my practice. Someone comes in with a surgical recommendation because they think they have a herniated disc. It turns out the pain is coming from the facet joint, not the disc at all. We use a different approach, and most of them are 90% better in 6 weeks. That surgery would have been completely wrong and unnecessary. Another patient has multiple things going on. The disc is involved, muscle tension is involved, inflammation from their metabolic state is involved. We do a few non-invasive treatments to calm things down around the acute nerve irritation. We start a regenerative medicine protocol to help the disc heal, and that patient gets 50% pain improvement in 3 to 6 months, and often more. Stop assuming the imaging is your diagnosis. Start with a thorough diagnostic assessment from someone who does minimally invasive spine work, not just the basic physical medicine approach. Start with targeted procedures that address the specific pain source you're actually identified. Start with regenerative medicine if inflammation or tissue damage is part of the problem. Start with movement changes that support healing. Start with advanced labs that show you what's actually happening in your body. So how do you actually make this decision? How do you know when surgery might genuinely be the answer? Well, that's point number 5. Point number 5, when surgery is actually necessary. There are definitely times when spine surgery is genuinely needed. If you have loss of bowel or bladder control, progressive weakness in your arms or legs, loss of motor sensation or sensory function are all surgical emergencies that should be addressed immediately by a surgeon. But short of that, there may be other options. The real question you need to ask isn't, should I have surgery? It's, have I actually tried everything else? Because here's what I've learned over the years. When you do things in order, when you do the diagnostic workup, when you try injections and regenerative medicine first, and you do movement training, you often find out that surgery either becomes totally unnecessary or ends up being a much simpler task than it would have been otherwise. When you do this the right way, you get results that are as good or better than surgery, with 0 recovery time, 0 risk of permanent nerve damage, and 0 complications from scar tissue. If you have a spine surgery recommendation right now, here's what you do today. First, call your surgeon's office. Ask them explain exactly which part of your spine they're operating on and exactly why removing or fusing it will solve your pain. Next, find a board-certified pain and spine specialist who does minimally invasive procedures, not just surgery. Number 3, get your imaging and request the advanced lab work. Actually understand what's happening. Number 4, commit to a structured, minimally invasive protocol for 8 weeks before you sign anything for surgery. Number 5, only after you've done all of that, only after you've really passed through the gate, should you have the surgery conversation again. And by that point, you'll probably realize you don't necessarily need it. I've been doing this for 20 years. I've seen thousands of patients who were headed for spine surgery they didn't need. I've also seen patients who genuinely needed surgery and they did really well because they did all the prep work first. Those surgeries were simpler, their recovery was faster, and the results were better. Your next step is to watch this video right here, why your back pain keeps coming back and why most doctors are treating the wrong thing. Watch that next.